do you have a history of any shoulder problems?
Do on my right side several years ago.
Okay. Do you have any a history of back issues?
My back is fine.
Okay. Do you have a history of any back issues? Any back injury?
Maybe like 15 years ago.
Okay. Yeah, so injuries, like imbalances that occur in the body, doesn't necessarily mean that you have pain. So there's two reasons why people develop elbow pain, especially as a hand therapist, right? Is poor body mechanics while you're working, right? So I always look at and think about, like, how do I work with somebody so I don't have to do that much, right? So the other thing is, like, you lack like a certain amount of stability, and you might potentially lack a little bit of strength, some strength, right? So we always want to make sure we're just looking at everything. So sit on the edge of your chair. Now you're on a rolling chair, so I'm gonna need you to cement your feet down so that your chair doesn't rotate, right? So I'm gonna lock your hips down. I'm gonna just take a look at your thoracic motion, right? So watch me first so I can come back and watch you, all right? Hands on your chest, relax your shoulders. You're gonna twist all the way to one side, come back, twist all the way to the other side, and then come back. All right, twist. Okay, so I can see that you have more, which side feels better for you?
Maybe this side?
All right,
Left side. One to my left.
so your left side feels better. All right, so I don't know if you guys see it, but left is better. The right side is actually the one that has less motion. No, the right side is the one that has more motion. The left side is the one that has less motion, right? Hold on. All right, so now with your arms straight, thumbs forward, you're just gonna bring your arms up and then bring it down. One arm. Okay. And then the other. All right, which side feels better?
My left one.
Your left one? I don't know if anyone else noticed, but when she moves, when I look at something, I always look at how their elbow moves. So when she brought up her right arm, her elbow just naturally bends, right? So thumbs all the way rotated downward. So I have it rotated completely behind me, and then you're gonna lift up your arm, all right? And then down, and then your other one. Do you feel that one?
Do I feel it where?
Bring it anywhere. Do you feel it?
No.
You don't feel it?
Do I feel elbow pain? Is that what you're asking?
No, anywhere. Do you feel it in your shoulder? Do you feel it down your elbow?
I mean, my right one feels tighter.
Your right one feels tight? Okay. So now you're gonna do your thumbs all the way rotated out. And then you're gonna, so you see how my thumb is rotated all the way out? Your thumbs play a huge role in your shoulder rotation. All right, good. All right. So in someone like that, did you see her right shoulder just kind of give a lot more than her left? Like it rotated out as she was, so you're just looking for little nuances of movement. You're looking for something compared to the other side that's abnormal. So where does your elbow hurt right now? Does it hurt at all?
Yeah, right in it's pretty much the epicondyle.
Yeah, the medial.
Yeah, there, right there.
That's all the time. All right, perfect. Does it hurt right now?
Yeah, my left one kind of hurts right
You
now.
feel it, right? You just kind of feel it constantly, right? Did you feel it when you were moving? Don't do it again, it's okay. Which position felt better? The thumbs forward, the thumbs down, or the thumbs out? It's okay, don't test it again.
I don't remember.
It's all right. I'm just seeing if you do or not. She does have lax ligaments. So put your arms straight out in front like this for me. And then you're just gonna bring both wrists all the way up. And then bring them both down. Do you feel it? Does it bother you?
It doesn't bother me.
Okay, bring your arms down by your side, and then you're gonna turn your palm up, and then you're gonna turn your palm down. All right, so it's like your right side has a ton more motion than your left side. Like, not a ton compared, but you still have, you feel tighter on your right side, right? Right, all right. What techniques have you tried? Have you tried kinesiotaping?
I did, and whatever technique it was really bad. It made it worse. And
Okay.
But I went to a PT, because I go to a PT now. That was helpful when he did something like, I think it's similar to the video that you have, but I couldn't use it because my skin was so irritated.
Okay.
But I think it was helping before it got really irritated. The one that.
Okay. So I want you to go, all right, I'm gonna have you do this first. All right, so hands on your chest, sit on the edge, plant your feet on the floor so your chair doesn't rotate. You're gonna rotate 10 times to your yummy side. So your left side is better than your right side, right? So twist, and look behind you. Twist, 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 twist. Go all the way. So anyone who wants to do this, you can do this too, right? So this really can help you, and you can see whether it helps to loosen up your shoulder. You're always gonna go to your yummy side.
Got 4 more.
I know it's very repetitive. God forbid I make you exercise. Everyone's like, but don't you want to just massage me? And the thing is like, so Cindy has to do certain things on her own. So I have to think, well, first of all, besides not being there, I can't teach her to use her other arm to treat because the other arm will hurt more, right? All right, so hands on your chest, twist to your right side and see if it got better. Did it feel, no, just one time, just one time.
Feels a little better.
Okay, so if it felt better, this is what you're gonna do. So watch this first, right? Hands on your chest, you're gonna twist as far as you can to the left, take a deep breath, let it go, and then come back. All right, 10 times, you count. So Dawn says, nope, to the yummy side, to the left. Oh, so you can just leave her. I was just showing you, like when you breathe, your rib cage moves, right? So yes, Dawn says that you can use a little bit of Miralax on the skin before applying the tape, and it will help with the irritation. The other thing you could do is not put any tension. So sometimes when people have really sensitive skin, you want to put even less tension than you normally would, and definitely always an inch off the ends. What was the question here? All right, 10 times. Take a deep breath. Do you guys see how her trunk rotation's already improved? Right? All right. So hands on chest, twist to the right side and see if it got better.
It feels good.
Okay, so the other thing you're gonna do is thumbs up. We're just gonna check. Bring your arms all the way up and down, thumbs up. Okay, bring it down. Check your other side. How does that feel? Does it feel a little bit looser on the right side?
Maybe a little bit.
Okay, so thumbs all the way down, and you're gonna bring it up.
Yeah, my right one's really tight now that
Did you feel it loosen up or no? All right, now test thumbs all the way out. Bring it up.
Yeah, it feels a little looser.
Okay, arms straight out like this. And then bring your wrist up. And then down. Usually what I'm looking for here is if she can't keep her elbows straight, is a lot of times it's a serratus anterior thing, but I don't see her elbows moving. So, all right. You are very loosey-goosey. So turn your palms up and turn your palms down.
When I do that, my right elbow hurts.
Your right elbow, turn it down. How's that feel?
My right elbow kind of hurts.
It hurt from that?
I think when I was maybe going to the end range of
To the end range? Okay. So you actually, all right, so go like this. grab from your tricep all the way up and just squeeze your elbow like together. Like you're approximating your joint a little bit, and turn and rotate your forearm. Does that feel looser? I mean, does it feel better?
It feels a little bit more secure.
Yeah. So sometimes if you're talking about a loosey-goosey person, one of the things that I'll do is I'll just grab the elbow. So I put my palm down here. So you're trying to approximate the joint, trying to pull everything together. And then you could check if that helps. It can supinate and pronate. And then you can wrist extension and flexion. And so there's a way that you can tape for that, right? To help you. Another thing that I might do is, you said that you're strengthening.
Yeah.
What are you strengthening?
The eccentrics. I was developing lateral epicondylitis too.
Yep.
So they were doing eccentrics for both.
Wrists?
Uh-huh.
Have you done any shoulder?
Oh yeah, he did some scab retractions because I told him I was trying to strengthen my back too. So yeah.
I hope that's not how you're doing it.
What do you mean?
So when you're doing retraction, like you want to squeeze and pull like this. So if you're doing pullbacks, you can do that. I would recommend, you know, one way that I'll do to check if it works using the total motion release technique is when you're trying to strengthen, try not to overly grip something because that will irritate you further, right? But one of the things that you can do is you would check. So I'll hold like a TheraBand and I'll put it around the palm or around the wrist with the palms up, and you have to make sure that you are in a good position. And if you can't control your shoulder, use a towel, because a towel is going to give you a little space, but it's not going to let you wing. So you can do with one arm and then the other, and you're going to go into external rotation, resisted. Then you're going to go into internal rotation, resisted, and then you're going to say which side feels better. Internal rotation feels better or external rotation feels better. And then you're going to exercise the side that feels better. So if you've got a lot of motion, which you do, then it's not range of motion. It's you don't have a lot of stability. Like you're lacking the strength to stabilize you. So if you're lacking strength in your shoulder, right? So yes, your wrist flexors hurt, but why are your wrist flexors hurting, right? Your wrist flexors are probably hurting because your shoulders are not stabilizing enough. And so all the force that you're working with are placed in your elbow. Your elbow is having to work, right? So you have a lot of motion, right? Which means you also you might not have a lot of stability because you're so loose jointed. So a lot of times there's a little bit of a give, right? So your joint's supposed to sit like this, right? But you might be off a little bit. You might be pulling in a certain direction. So that's why like pulling it together like this can help you, but it's a little hard to do that tape yourself. I think there's a video in the showcase that shows that tape, that shows that technique, where I'll do either a star here or I'll do kind of like for a knee. It looks like this, and then around the elbow.
Hey therapy friends, it's Huang here. Thanks again for watching my video. And if you like videos like this that can help you just crush it in the hand therapy world as an occupational therapist, then hit the subscribe button and enjoy the video. Thanks again for watching.